test item cluster for patients with neck pain likely to benefit from thoracic manipulation includes symptoms less than 30 days, no symptoms distal to the shoulder, looking up doesn't aggravate their symptoms, an FABQ score less than 12, diminished upper thoracic spine kyphosis, and cervical extension range of motion less than 30 degrees. Can you go ahead and do this motion for me? Look up at the ceiling. Okay, good. Relax. I'm just going to measure that. Okay, go ahead and look up. All right, very good. Relax. The test item cluster for subacromial impingement syndrome includes a Hawkins-Kennedy impingement sign test. With this test, I'm going to have my patient flex her shoulder to 90 degrees. We're going to immediately rotate the arm 45 degrees and horizontally adduct. A positive test would include one that she has pain in. We also have the painful arc sign. So with this test, I'm going to have her actively abduct the shoulder, and she would have pain within 60 to 120 degrees. And then the infraspinatus test, so I'm going to have her flex the elbow to 90 degrees with the hand in neutral. I'm going to apply a medial direction force and have her resist. And a positive test would include pain or weakness. The test item cluster for full thickness rotator cuff tears includes the drop arm test. So with this test, I'm going to have my patient abduct her arm to 90 degrees, and I want her, as soon as I let go, to slowly lower the arm to her side. And a positive test would include one where she has pain or an inability to slowly lower the arm. And then the other two tests as part of this cluster are the painful arc sign and the infraspinatus test, which we did in our previous video. The test item cluster for mechanical neck pain that will benefit from cervical manipulation includes patient symptoms less than 38 days, patient expectation that manipulation will help, cervical rotation range of motion difference of 10 degrees or more between left and right. Go ahead and look over your right shoulder for me. Very good. And go ahead and look over your left shoulder for me. Okay, excellent. Relax. And the last test will be pain with a posterior to anterior testing of the mid-cervical spine. So for this test, I'm just going to apply a posterior to anterior directed force through the spinous process of the mid-cervical spine. The test item cluster for cervical radiculopathy includes 4 separate tests. The first being the upper limb tension test of the median nerve. We would need a positive test on this. So what I'm going to do is I'm going to go ahead and depress the scapula, extending the arm, putting tension on that median nerve. To sensitize the test, I'll have Kat go ahead and flex her head laterally to the opposite side, and then go ahead and flex it to the affected side. Okay, very good. And the second test would be the neck distraction test. So for this one, I'm going to go ahead and distract the neck. And a positive test with this would include relief of pain. And the third test is the Sperling's test. So I would need a positive test with this. I would put a mirror in front of Kat so that I could make sure I'm seeing any signs of facial expressions of pain. I'll go ahead and have her laterally flex her head to the affected side. And then I'm going to apply a compressive force. A positive test would be indicated by reproduction of her symptoms. The final test is less than 60 degrees ipsilateral cervical rotation. The upper limb tension test 2B focuses tension on the radial nerve with the patient supine, the shoulder abducted 10 degrees, and the elbow flexed to 90 degrees. I'm going to depress the scapula with my hip, apply medial rotation to the shoulder, fully extend the elbow, and provide wrist and finger flexion. To sensitize the test, I can have the patient laterally flex the head to the contralateral and ipsilateral side. Positive test findings include a reproduction of the patient's symptoms or elbow extension range of motion difference of at least 10 degrees between sides to elicit symptoms. Differential diagnosis for a rotator cuff tear versus a C5, C6 radiculopathy. With a rotator cuff tear, you would expect to see limited active range of motion but full passive range of motion, a positive drop arm sign, a positive infraspinatus muscle test, positive Hawkins-Kennedy impingement sign, a negative distraction test, negative upper limb tension test, negative Sperling's test, and normal reflexes and sensation. With C5, C6 radiculopathy, you would see a positive distraction test, positive upper limb neurodynamic test, positive Sperling's test, Positive shoulder abduction test. So with this test, I'm going to have Kat go ahead and place her affected arm on top of her head. And I would ask if this alleviated her symptoms at all. If so, then I would call that a positive test. Negative Hawkins-Kennedy impingement sign. Limited cervical rotation range of motion to the ipsilateral side. Possible numbness, tingling in the C5, C6 dermatome. Possible weakness in shoulder external and internal rotation, as well as elbow flexion and wrist extension, and diminished C5, C6 reflexes, which includes the biceps and brachioradialis. The load and shift test. The load portion is done by grasping the humeral head and positioning it in the glenoid fossa. Then the shift portion is done by positioning the humeral head anteriorly and posteriorly, noting the amount of translation and infill compared bilaterally to determine atraumatic instability. The active compression test of O'Brien is used to detect a superior labral tear. The patient's arm is flexed to 90 degrees with the elbow fully extended. The arm is then horizontally adducted 10 to 15 degrees and medially rotated so that the thumb faces down. The examiner applies a downward force to the arm while the patient resists. The arm is then returned to the starting position with the palm supinated and the force is applied again. Positive test results are indicated by pain, weakness, or clicking with only the first portion of the test. The lift-off sign test. The patient places the back of their hand on their pocket and then lifts away from their back. If the patient is able to do so, the examiner applies a force pushing the hand towards the pocket to test the subscapularis muscle strength. The supraspinatus or empty can test is used to detect supraspinatus tendon pathology. The patient's arm is abducted to 90 degrees with the hand in neutral. The examiner provides resistance to abduction. The shoulder is then medially rotated and placed in scaption or the empty can position. Resistance to abduction is then applied again. Positive test to be indicated by any weakness or pain.